Hello friends, welcome to my channel Clinical Biochemistry with Dr. PK Prabhakar. Nowadays, in many restaurants, many places, you might have seen that they have written that they are going to serve or they are serving gluten-free pizza or gluten-free buns. Why this is going to happen? Why? What is the meaning of this one? Today we will see what is this gluten and why they are selling like that one. So So today we are going to talk about a specific disease which is related to this gluten, and the name of the disease is celiac disease. This celiac disease have multiple names. Sometimes it is also known as celiac sprue or non-tropical sprue or gluten sensitive enteropathy. So different kind of names it is having. So if you say this celiac disease, it is a disease of chronic digestive and immune disorder, means where it is basically a problem of digestive system which is going to happen due to the immune system or immune immune system or immune cells or immune component associated disorder, which is going to damage our small intestine, especially the duodenum region. So this disease is triggered by eating a specific food content, food protein, literally, basically you should know, and that is the gluten. So that's why it is. This is the component which is basically responsible for this celiac disease. So what is this gluten? This gluten is a protein which forms naturally in the different kind of grains like wheat, barley, rye, and it is also common in some of the specific foods like bread, pizza, cookies, and cakes. So many places you can find it where grains we are going to use for making those products. Many products which contains gluten, such as packaged foods, lip balms and lipsticks, toothpastes, vitamins and nutrient supplements, and rarely medicines also. So there also we are going to find this gluten. This celiac disease, it can be serious. Later on, we will see when it is going to be serious and how it is going to be happen. The disease can be cause long-lasting digestive problem and keep our body from getting all the nutrients as it requires, because ultimately it is going to affect our digestive system, especially the villi and microvilli. So ultimately, it is going to affect our digestive system, absorptive system, and keep our body divide from the getting all the nutrients. Celiac disease can also affect our body outside the small intestine. So if you see, this is the two picture I'm going to show you. This is the normal microvilli where you can see the finger-like projections, which normally increases the absorptive surface area of the intestine, small intestine. So absorption will be there. In the case of celiac disease, these microvilli, which is normally finger-like projections and increases the surface area, is going to be flattened. So they are going to be damaged microvilli. So here you can see this is the microvilli, which is the damage. In the second picture also you can see more clearly. This is the normal microvilli, which is finger-like projections, which increase the absorptive surface area. But in second cases, this microvilli has got flattened, so surface area got reduced, and ultimately it is going to cause the absorption of the food nutrients. So body will be deficient of many of the things. So wheat allergy, there are two specific terms we are going to use. Later on, we will use a third term also. Two terms, that is wheat allergy and celiac disease. Is it the same or it is the different thing? What is wheat allergy? Wheat allergy occurs when our body produces antibodies to protein which is present in wheat only. And the celiac disease is a specific protein. In this case, a specific protein, that is the gluten, causes a different kind of abnormal immune system. So in this case, in the wheat allergy, body is or immune system is working against any of the component which is present in the wheat. It may be protein, it may be different other components also. Mainly proteins are the most antigenic, so that's why protein is going to cause. In celiac disease, it is mainly because of the gluten only. So here I'm going to use three specific terms and we will see the differences between these three. Celiac disease, gluten sensitivity, and the wheat allergy. Celiac disease is different from the gluten sensitivity or wheat intolerance, or we can call it wheat allergy. If someone is having gluten insensitivity, second one, celiac disease, later on we will see the details. So if someone is having gluten sensitivity, he may have the symptoms like those of celiac disease, such as abnormal pain and tiredness. But the difference is gluten sensitivity does not damage the small intestine. But in celiac disease, later on we will see the picture that how it is going to damage the small intestine and the brush borders. Celiac disease is also different from the wheat allergy, which is a type of food allergy. In both the cases, body's immune system reacts to wheat or wheat specific proteins. However, in some symptoms of wheat allergy, such as having itchy eyes and hard time of breathing, are different from celiac disease. So in celiac disease, normally we don't have itchy eyes and we don't have problem in the breathing. So these are the differences. Wheat allergy also does not cause a long-term damage to the small intestine. So here the tabular forms, we have the difference between the celiac disease, gluten sensitivity, and the wheat allergy. Onset uh, of the disease symptoms are week to year in case of celiac disease. Gluten sensitivity, it is hours to day, and because it is the allergy, so allergic reactions are instant energy, instant reactions. You can call it instant hypersensitivity reaction. So it is going to happen in minutes to hours. The pathophysiology of celiac disease is autoimmune system. Our immune system starts working against our own protein. In case of gluten sensitivity, immune mediated immune system going to start. And in case of wheat allergy, also it is allergic reaction, so IgE is going to involve. Best initial testing is this is TTG serology. Later on, we will see how we are going to diagnose it. And in case of gluten sensitivity, it is going to diagnose the exclusion, or a skin prick test in case of wheat allergy. That is for normally for all the allergic reaction. Best confirmatory test in case of celiac disease is small intestine biopsy, and non-celiac gluten sensitivity it is not required, and in case of wheat allergy it is oral challenge test. Okay, so these are the difference between these three diseases. Now, how common the celiac disease is, how frequently it is going to happen. So many people who have the celiac disease have not been diagnosed, so they are having unlike means undiagnosed, you can call it. Okay. So, experts estimate that roughly 2 million people in the United States have celiac disease, and about 1% of the people around the world have celiac disease. And there are references for this one. So, roughly in USA, 1 out of 100 people is going to have celiac disease. Who is more likely to develop celiac disease? Celiac disease can occur in people who have certain specific genes, like you know that in our case, whenever proteins are going to be digested, either it will be indigenous protein or exogenous protein, it is going to be presented on the cells with the help of MHC, major histocompatibility complex, which is normally the product of HLA genes. So MHC, major histocompatibility complex, is a product of HLA genes. So people are more likely to develop celiac disease if someone is having family history of that particular disease. Other than that one, celiac disease affects children and adults in all parts of the world. In the United States, celiac disease is very common among white Americans than among other racial and ethnic groups. Roughly, I have already told you it is 1 in 100. The celiac disease diagnosis is more common in females than in males. And celiac disease is also more common in people who have certain chromosomal abnormalities, like who is having the Down syndrome, Turner syndrome, or Williams syndromes. Okay. What are the other complications is going to happen present in the person who is going to have celiac disease? So experts have found that some people with the celiac disease and other disorders related to the immune system, these disorders includes like type 1 diabetes. They may have thyroid disease such as Hashimoto thyroiditis, Graves disease, Addison's disease, primary hyperparathyroidism, and sometimes selective immunoglobulin, that is A deficiency. Then rheumatoid disease like Sjogren's syndromes, sometimes liver's disease. Okay. If we are talking only about the long-term complications of celiac disease are accelerated osteoporosis or bone softening, such as osteomalacia. Then we are having anemia, malnourishment, a condition in which our body does not get enough vitamins, minerals, and other nutrients. Nervous system problems, problem associated with the reproductive system. These are the long-term complications. Some rare complications occurs, that is adenocarcinoma, which is a specific type of cancer for the small intestine. Hepatotoxicity, hepatic damage, liver damage, which may leads to cirrhosis of liver or liver failure. A non-Hodgkin's lymphoma. In rare cases, patients may continue to have trouble absorbing nutrients even though they have been following the strict gluten-free diets. If patients have these conditions, this is called as a refractory celiac disease. And the small intestine is severely damaged and cannot be healed. In this case, need to receive intravenous nutrients and specialized treatment. Okay. Now, if you see the symptoms of celiac disease. These are the common symptoms of celiac disease like bloating, nausea, fatigueness, diarrhea, gastrointestinal distress, weight loss, stomach pain, and headache. Okay. Other than this one, like if you see in the children's, they are having normally abdominal distensions, that is bloating, failure to thrive, diarrhea. Whereas in case of adult, the common symptoms are chronic diarrhea, bloating, and symptoms vary again person to persons. And one specific symptoms, specific cases, you can see that is dermatitis hypertiformis. This herpetiformis. Herpes, by don't confuse with this name because it is not related to the herpes virus. So, what is this disease? If you'll this see this in case of this disease, herpetitis, dermatitis herpetiformis, it is an itchy, blistering skin rash that usually appears in the elbow, knee, buttock, back, and scalps. Among people with the untreated celiac disease, about 2 to 3% of children and 10 to 20% of the adult have dermatitis herpetiformis. Some people with celiac disease may have a rash and no other symptoms. After a person starts a gluten-free diet, the rash may take some time to heal and may return if a person consumes a small amount of gluten. So, depending on gluten intake or gluten stoppage of in the food, these rashes are going to happen or going to subside. Not what is exactly the cause of the celiac disease? Research suggests that celiac disease only occurs in the people who have certain specific gene and eat food which contains the gluten. So either it is because of the gene associated with our body, that is HLA gene, some specific HLA genes, or gluten means intake of gluten. So celiac disease almost always occurs in people who have one or two form of normal genes variants, that is DQ2 or DQ8. This is the variant of HLA genes which normally gives us you can call it HLA genes. So the people who does not have these two variant of genes DQ2 or DQ8 are very unlikely to develop celiac disease. So any person who is having these two variant of the genes, they are very high risk of getting celiac disease. So roughly 30% of the people who is having this DQ2 or DQ8, they are going to get celiac disease. Only 3% of people with DQ2 or DQ8 develops celiac disease. Okay. So, consuming gluten triggers the abnormal immune system response and ultimately it is going to cause celiac disease. However, not all people who have these gene variants and eat gluten develop the disease. So, uh, how it is going to happen? If you'll see, this is the wheat kernel which is having the endosperm which normally contains the nutrients. These nutrients are either protein or starch and vitamins. And this specific protein which is the gluten, this gluten, not only wheat and other grains also, they contains gluten, which is having a 33 amino acid long peptide that is called as gliadin. And this gluten gliadin is going to start the immune responses. So our immune system start responses against this gluten and gliadin. So it is going to affect our small intestine. Like whenever we are going to eat this gluten gliadin in the small intestine lumen, this gluten is going to be metabolized and a gliadin will be released. This gliadin is going to associated with the secretory immunoglobulins A. After the secretory this association, normally these combinations, this association is going to degrade this gliadin and IgA. But sometimes this combination, this conjugates are going to be taken inside the cells into the enterocytes with the help of transferrin receptor present onto the cells of intestinal lumen. Once it will be taken inside the lumens as the lamina propria, this is going to be digested. Then this gliadin is going to have the amide is going to be released, and tissue transagglutinase, this is the enzyme which is going to degrade this one. So this enzyme normally, as its name suggests, this is transglutaminase. So it removes the amide group. So deaminated gliadin is going to be remained. This is a peptide, deaminated gliadin protein peptides, which is going to be digested by the macrophage into the lamina propria, and ultimately it is going to be processed and presented onto the MHC2 gene. Once it is going to be presented on the MHC2 genes, then it is going to be recognized by different immunological cells. Normally in our body, we are having HLA. I have told you this MHC2 gene is the product of HLA genes. HLA, that is we are having HLA-DQ and HLA-DR, which normally gives these MHC2 genes. But in case of celiac disease, we are having two specific variant of this HLA genes, that is HLA-DQ2 and HLA-DQ8. So if someone is going to have these two variants, normally they are having a very high chances of getting this celiac disease. So if you'll say, once it is going to be processed and presented onto the MHC2, this is going to be recognized by T helper cells, and then there are number of things are going to happen. It is going to release the inflammatory or pro-inflammatory cytokines such as interferon gamma, tumor necrosis factor alpha. These inflammatory cytokines walks onto the enterocytes and ultimately going to damage them. So once this is going to be damaged, so whatever gliadin will we are going to have here, their entry will be more facilitated. So more gliadin comes into the lamina propria. That is one way. So once it will be damaged, more damage is going to happen now. Other than that one, this T helper cells also going to activate B cells, and this B cells ultimately going to produce immunoglobulins, that is anti-gliadin immunoglobulins, TTG globulins, and anti-endomysial, that is EMH. This EMA, that is antibody to TTG on endomysium. Normally, this endomysium is present on into the muscles. So, why we are not sure why this is going to be produced, but as this disease is not associated with any kind of muscular association. So there is no muscular association. So we don't know. It is not very clear that why anti-immunoglobulin against this TTG or going to be produced. Now, how this is going to be diagnosed? So, if you'll see the diagnosis of this, doctors uses informations from the medical and the family history, or physical exams, or the dental exams, or medical tests results to look for signs that are normally causes the celiac disease and should be tested. Doctors typically diagnose normally celiac disease with the blood test and the biopsies of the small intestine. Now, if we'll say, doctors most often uses blood test and biopsy of the small intestine to diagnose the or rule out of the celiac disease. So, your doctor will ask about your first, if you see the medical history. Normally, doctors asking about the symptoms. Celiac disease is not diagnosed based on the symptoms alone, because some of the symptoms are like the symptoms of other digestive disorders, such as irritable bowel syndrome, that is IBS, or lactose intolerance. So, the symptoms of celiac disease is normally comparable with the IBS or the lactose intolerance. So, only on the basis of symptom you cannot diagnose it. So that's why blood test is important, or the physical tests are important. Okay, so blood test can show a level of certain antibodies that are often higher in than the normal in the people who are have untreated celiac disease. A doctor often biopsies of the small intestine during the upper GI endoscopy. So this is the antibody test from blood test. So normally in blood test we are going to have three components. Normally we are going to see all those immunoglobulins, like either anti-gliadin or anti-TTG or anti-indomycial. In most of the cases, the anti-TTG or anti-indomycial EMA are more specific and more than 98% sensitive and very specific. So it is super effective, you can call it. Whereas anti-gliadin are less sensitive and less specific, so it is pretty effective but not as effective as anti-TTG or anti-indomycial. Roughly into 1 to 2% cases, celiac patient IgA deficiency are also having. So in that case, no Ig immunoglobulin A antibodies can be found. So in that case, we can go for diagnosis of IgG antibodies. When we are going to do biopsy, that time this is the normal healthy tissue where we can see tall microvilli. So this is the finger like projection, tall microvilli, you can see it. Whereas in case of celiac disease, you can see this microvilli is not as tall as, so it is just flattened microvilli. And lymphatic infiltration also you can see here. So this is how it is going to be uh, diagnosed, either by the blood test or by the uh, you can call it biopsy test. When we are going to talk about that treatments, so doctors normally gives three basic important way of management or a way of treatment we are having. First one is gluten-free diet. So doctors treat celiac disease by helping people to obtain gluten-free diet. Uh, means as we know, the gluten is a protein which normally present in grains or certain kind of food. So gluten is also added in many foods and many products. So avoid those products where glutens are present. So gluten-free diet, that is the one option. Second option is avoid medicines and other products that contain glutens. In addition to prescribing gluten-free diet, your doctors will want you to avoid all hidden sources of gluten. If you have celiac disease, ask a pharmacist about the ingredients of herbal and nutrient supplements, prescription and over-the-counter medicines, vitamins and mineral supplements. So medicines are rare source of gluten. Even if gluten is present in a medicine, it is likely to be in very small quantities. So there you can be saved. But there are number of products which contains gluten, like children molding dough such as play-doh, cosmetics, lipsticks, lip gloss or lip balms, skin and hair products, toothpaste, mouthwash, wafers. These contains gluten, so avoid all those things. And the third thing is we are having a treatment for the symptoms or complications. So a gluten-free diet will treat or prevent many of the symptoms and complications of celiac disease. Some symptoms may take longer to get better than others, and some symptoms may need additional helps. Like dermatitis herpetiformis may not go away until a person have been following a gluten-free diet for 6 months or to 2 years. In some cases, doctors may prescribe a medicine such as dapsone to treat the dermatitis herpetiformis until the rash is under control or a gluten with a gluten-free diet alone. So these are some of the important information. But if this celiac disease is untreated, damage to the small intestine can lead to malabsorption and malnourishment nutrition also. When you are diagnosed with celiac disease, your doctors may test you to low level of certain vitamins and minerals and may recommend to prescribe some supplementary vitamins uh, should be given or should be required. So this is all about celiac disease. Hope you have understand it. If you have any query, any comments, you can write in the comment box. If you're not subscribed my channel, you can subscribe my channel. Now YouTube has activated the thanks button also on my channel. If you want to support us, you can click on the thanks button and you can support. Thank you very much. Have a nice day.